everybody. I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures, and we take your calls live on the air. With us this morning, we have plastic surgeon Dr. Joseph Mele. Later, we're going to be taking your calls, answering any questions you might have about plastic surgery. Here's the number, 800-440-4884. We'll also be posting Dr. Mele's office number during the show, so be ready to jot that down. And before we get started, any advice we give you today, certainly you're going to want to consult your own physician for a second or even third opinion, right?
It's a good idea.
Always a good idea. Well, welcome back to the show, Dr. Mele.
Thank you. Nice to be here.
We're going to be talking about a certain area of the body today, mostly abdominal rejuvenation, a.k.a.
the tummy tuck or lipo.
Yeah.
Yes.
Tummy tucks. We're going to be covering plastic surgery after weight loss, such as bariatric surgery. Okay, a lot of big terms that are out
big
here.
words, big words. Massive weight loss is another way to say it.
So what's the difference between the bariatric liposuction versus tummy tuck?
With the bariatric patients, they've lost a lot of weight. I have bariatric patients who've lost over 150 pounds. So a lot of the fat is gone, but the skin gets stretched. It's just like we use tissue expanders when we're trying to make extra skin. The skin gets stretched by that extra weight. And then my job is to go back in there and get rid of that draping, get rid of that extra skin so that they fit in clothing, they feel better. They've done so much work, they want to feel good about how they feel.
Any kids that have ever had water balloons, you know, you take a little balloon, you fill it with water.
You can blow it up a lot.
Yeah, if you don't pop it. But basically you look and it's it's stretched out. Now the skin has a natural, I guess, elasticity, right?
Yes, it's able to stretch and accommodate, and after a while it actually will grow. We'll grow more skin. And that's part of the problem, is we grow that skin and we have no way to make them go away again.
Is it that it never will go back, or that it just takes so long, or what?
It takes a long time if it's going to go back, but it's good to wait at least a year. I tell the same thing to women who've been through pregnancy, they've got extra skin. It's good to wait that year to let the skin recoil as much as possible. It makes my job easier. Sometimes it obviates the need for surgery.
Mommy makeovers are a big thing.
Sure, lots of mommies around here.
Yes, and you know, the body does really get stretched in amazing ways for anyone who's ever had a child. But nature kind of provides for things to just come back together, or doesn't it? I mean, there are some people that maybe genetically don't spring back as easily.
Genetics come into play, plus the amount of weight that's gained or lost, the type of shape you're in before getting pregnant, maintaining your shape through the pregnancy, all those things are helpful, but there's no guarantee. And there's some people, they just grow this extra skin, they stretch out their muscles because the baby's inside pushing out, and the only way to really tighten it up is surgically.
Okay.
I wish I had a skin shrinking ray.
Boy,
then I wouldn't have to make
a lot of money off of that.
Yeah, I think so.
We won't even talk about stretch marks. That's a whole other topic.
Yeah, I don't have any good
answers,
and there's no good answers for it.
There's nothing plastic surgery can do for stretch marks, or
no? The only stretch marks I could truly take care of are the ones below the belly button when we do a tummy tuck. Because when I do a tummy tuck, I'm removing the skin that has the stretch marks on it, and then they're gone. But as far as lasers, other treatments, there are things that can make them a little less noticeable, but we can't ever get them to go away. All
right, so in terms of actual pounds, you know, you hear with liposuction, there really is kind of a limit of how much fat you want to take out of the body, because it's just a shock to the system. Right?
Well, it's trauma. So even though the incisions are very small, the area that we're working on is usually much larger. And it's similar to a burn, similar to any sort of injury, it has to heal. So there's a voluntary limit right now of about 5 liters, which is a very safe amount to remove. It's about 10 or 11 pounds. And with that, most people can have that type of surgery, go home the same day, and recover without too much trouble.
Okay. Now, as opposed to the bariatric,
the bariatric procedures usually are much more involved than just liposuction. Since we're removing skin, we're talking about incisions, having to sew those incisions, close them up. Most of my bariatric patients I will keep overnight if we're doing tummy tucks or some of the other bigger tucks.
But in terms of how many pounds you can take at once in that procedure?
It's really variable. It depends on how much skin there is. So I'm not really going after weight. I'm more tailoring what's left.
Okay, we've got some calls coming in, but we've got to take a little quick break here. For more information about Dr. Mele, you can call 925-943-6353, or you can check them out on the web at drmele.com. We'll be taking your phone calls and continue our talk about plastic surgery when we come back on Body Beautiful.